What's up, everybody? Ian Marco here, and we are taking through a case study today about lower back pain. This is going to be perfect for three different kind of viewers. The first one is going to be a physical therapist who deals with a lot of back pain. The second one is going to be for a personal trainer who's not trying to be the physical therapist, but still wants to help their client and help them train around back pain. And then three, someone who maybe suffers from back pain, especially an acute episode, meaning your back went out, which it didn't, but just having that one episode of, wow, my back's really hurting and I can't really round over. So to add a little bit of context, we're talking about my wife, Jasmine. She's training around 6 to 7 days a week at this point. The stress bucket is getting pretty full. She's spending a lot of nights sleeping in a little blue race car bed with my son, and definitely doing a lot of holding my son on her right hip with her right hip hiked up. In this particular workout, we had gotten through a lot of a lower body session, and then when we went on to the hack squat, she felt something pull in her lower back on the way down, and it made it really hard to flex her spine and round over to pick anything up. We can also say that she was feeling a lot of pain going down the side of her hip, not necessarily sciatica-like systems all the way down, but more so in the high part of the hip. Let's go ahead and go into the specific solutions that we used right now. The first solution we chose was a Hookline Low Cross Connect. So what we're looking at here is giving someone some stability, some safety, and some constraint, which the ground is going to really do that. With people that are struggling to bend over, they're probably going to struggle in deeper levels of hip flexion. So where a 90-90 bridge might be a great idea for some, getting them to be more in hook line with less hip flexion is probably going to be a little bit of a better position to start. And then because Jazzy was feeling this on the right side of her lower back, and we talked about that compression that she was feeling, like her back right ribs and her right hip or pelvis were being pulled together and arched. By choosing this variation and lifting the left foot, if you just lay down on your back and you lift your left foot, what you should feel is your body actually rolls over to your right side and gets heavier on the right side. So essentially the part of her body that's trying to arch off of the ground is going to be biased towards actually relaxing into the ground. The other thing that we can think of, if you're feeling it all through your back, if you're the person that's going through this for yourself, you could just do everything I'm about to do, but hook line and just do everything the same cues, just like this, okay? With both legs. We can even put a ball between our knees if you want to do that. Or if you're someone with that back pain on the left side, maybe it's as simple as just lifting your right foot instead. So let's get into the actual exercise. I'm not going to do too much of it, but I'm just going to quickly show you. So I'm going to push my right foot down into the ground. I'm right here. I'm going to gently tuck my butt under me. I want to try to do it without squeezing my abs and crunching a lot. I want to keep this relaxed like a jelly belly and try to use my hamstrings, specifically my proximal hamstrings, to gently tuck my butt under the ground as I push through the floor. Those two things should happen at the same time. Then from there, what I'm going to do is I'm going to lift this up and I'm just going to grab it gently with my left hand. Same thing with the hip flexion. If I can grab it here and it's perfectly fine and I'm comfortable, that works. I could even use a towel and I could just hold that right here. So I'm just holding this like this. I'm going to take my right arm. I'm not going to reach it high for this variation. I want to reach it a little bit lower, and I'm not going to do it so much that I'm crunching up. My head is relaxed, my chin is untucked, my eyes are up at the ceiling. I'm going to make sure that my knee is in line with my foot too. It's really common for people to, especially on the right side, to let their knee fall out and lose the inside of their foot. So make sure you can feel your whole inside foot there. You're going to press down. As you inhale, you're just going to think about gently taking this right elbow a little bit more in this direction, reaching low and away from my body. And I might even add a little bit towards the opposite knee if I'm comfortable enough, but again, not rolling everything off, okay? I still want to keep heavy, especially for this exercise, on the back side of my right pelvis. So think if you had a Lululemon symbol just to the right of that symbol, or the tag on your boxers just to the right of that symbol, I want that to be heavy on the ground. That's the exact spot that's arching off of the ground in this context. So I just go here, I go inhale, I think about letting this reach closer to here, and then I exhale, push through my right foot. Simple as that. Relaxed inhales, in through the nose, mouth is sealed, jaw is relaxed, eyes are up to the ceiling. Exhale as long as I can comfortably, pause. If I can pause for 1 to 3 seconds, that would be great. Inhale nice and slow and relaxed after. Reach a little bit more on the inhale without going crazy and tensing up. Exhale, push through the foot. You're always pushing through this foot the whole time. It's just a little bit of extra emphasis. You'll get that. 2 sets can make a big difference, but 4 sets is going to be the best. 5 to 8 breaths is what I like. And this is really great to just do straightforward. So you do a couple of breaths, you rest for a second, do a couple of breaths, rest for a second, and try to knock out 4 sets in a row. And then you can even test it a little bit. Get up and see how you feel. See if it feels a little bit better, and you usually get some good benefits from it, just feeling good right off of the start. So that's exercise number 1. All right, exercise number 2. Arguably the most important thing for people with back pain is getting pelvic control back. So many people are scared to round their back or arch their back. You're really just trying to get that graded exposure of slowly regaining your pelvis's ability to tilt forward and tilt back. What I like to do is get them here. Again, we discussed with the Hookline, because they're probably a little bit limited in hip flexion. If they have back pain, it might hurt them. We can do it from here, and that's gonna create a little bit more space in the front of the pelvis especially. So you can just look straight up, take your hands, grab the bony parts of the front of your pelvis and the back, and then you're just gonna go ahead and inhale, forward, exhale back. So just nice, pelvic tilts. It's not an exact science, meaning if you actually want to inhale the opposite way, you can. In general, you're getting a nice stretch on your 6-pack here, which you can inhale into. And when you exhale, you're going to get a little bit more hamstring. That works. If you notice your knees are falling all over the place, maybe put a ball between your knees just so that they stay in line with your feet. And we're just getting nice, easy pelvic tilts. If you go so far that your back starts to hurt, just go a little bit less. If you try to round under too much and it starts to hurt, go a little bit less. And as always, try to really get your motion to come from your hamstrings tucking your butt under you, not just tensing up your abs really hard. That's huge. That's definitely something that we want to make sure is happening. So for those first 2 exercises, I like doing the Hookline Cross Connect for 4 sets first, because usually that's going to open up space, and then the pelvic tilts will allow you to move into that space and kind of control that range of motion. That's for the first day, and especially maybe even immediately if you're in the middle of your workout. Doing this after, you'll kind of feel better. It should be easier to get home instead of like really hunching over to your car. But over the subsequent days, maybe the 2nd to 3rd day, feel free to do a couple of pelvic tilts in between the Hookline Cross Connect. Just like I mentioned, as you're doing the Hookline Cross Connect, it should feel better, and you should be able to even use the pelvic tilts as a little bit of a KPI or key performance indicator, meaning, is it helping? Am I feeling a little bit better? Can I move my spine a little bit easier? So that's what we would do. That's kind of, again, super general guidelines, but that's kind of like the first phase of, hey, my back started to hurt. Let me go ahead and address it with these 2 basic exercises. Moving on to the next phase of exercises. So this could be your 2nd day. Some people might even be able to do this at the first. It obviously depends on the severity of the back. We started doing this around the 2nd and the 3rd day in this context. One of the most important things you want to understand with people with injuries is, A, they need the confidence to regain the motions that they lost. So we talked about not being able to round your back, not being able to bend over. So as soon as possible, we want to get them to round their back and do it as close to pain-free as possible. Again, general guidelines, but 0 to 3 out of pain or just a little discomfort is probably where we need to be. If you get to higher, like 4, 5, 6, obviously not 9, those are going to be things that give us a step back. So we want to kind of flirt with that line, but never go over it. And then the other thing that people, especially with any back pain or knee or hip or even foot or ankle, they really lose the ability to confidently push through the ground. They're kind of sliding through life or chunking along versus really getting solid pushes through the ground. So anytime we can combine those 2 things in the same exercise, it can be extremely beneficial. Now, couple of considerations. This box is going to probably put me somewhere around 85, maybe 80 degrees of hip flexion. If the person feels locked at the hip already, it might be a little bit too low. So if I needed to, I could stack higher boxes or sit on a chair at home, or you could put yoga blocks under my butt, okay? From there, I'm gonna find a comfortable stance. Some people are gonna like to be a little bit more narrow, but in general, someone's probably gonna be a little bit wider, just like you see people more comfortable squatting like this. I'm gonna start off with my hands low as a regression, and I'm just gonna go ahead and look up. Hopefully that's pain-free. And then I'm gonna go ahead and start segmenting my spine from the top of my head. So I'm just gonna one by one, slowly round down until I eventually round my back. And early on, a lot of people are gonna go, oh, any more than this hurts really bad. Okay, so stop here. Now, push through the ground and then slowly, one by one, go ahead and lift up and then lift your chin. On the next one, they might be able to go a little bit further, like they're getting closer to the ground. Make sure that you cue them to push through the ground to come back up. They can go a little bit slower as a progression to get better at the segmentation. And then on the last one, what we can do is we can go ahead and start to put the arms up. So have them go into a little bit more extension of their upper back to start, and then slowly round down. And then once they get down, they can reach their arms down. And then from there, we want to introduce just a little bit of direction. So maybe that's what they do for the 2 days. And then on the third day, what they can do is they can start working on rounding down and going off one. Now I got to push a little bit harder through my left foot to come all the way up. And then I can extend with rotation. And then I can rotate over there and come down. If one side feels a little bit off, you can go ahead and either do it, but don't go as far, or stay away from that side for a couple of days and then check back into it. But again, we're trying to restore the ability to push through the floor and round our back while we're keeping our spine moving. So that's the first one in this phase. Let's go ahead and show the second exercise now. So in addition to getting that flexion, an eventual rotation and extension through the spine, we do want to get lateral flexion or just side bending. This is going to be great for anyone, but especially someone that's dealing with back pain. As you can see, getting someone's spine, especially above their lower back, meaning their rib cage and their thoracic spine moving, even their neck, will offload their lower back and restore movement options so that their lower back will heal much faster. Now, by doing this, we're also going to get length through the outside of the hip, and we're also going to get our rib cage to open on one side and close down on the other. This is extremely important. If someone has one-sided back pain, we're also teaching them how to laterally shift weight, which is also a really, really great thing that we're checking off with these exercises. So this is as simple as this. When they first start, they're probably gonna look like this. Just these little micro movements, that's fine. Whatever they can do, that's in that same threshold of pain-free ideally, but 0 to 3 maybe. And eventually they'll be able to push their hips so far to the side that they can actually reach down to basically getting to their knee. They'll feel a big opening on this side. They won't feel a pinching or closing on here in the back. If someone is feeling something negative like their back, most likely what they're doing is they're starting off in a position, especially of extension, that stops them. So maybe they need to just do something like a low reach and bring the ribs back, get their stack a little bit better, and then go into the side bend from there. That's super common. The other good cue is to think you're in a phone booth. Because we're looking for lateral flexion and side-to-side movement, if I go and I do this and I start turning a lot with my chest, I'm trying to fake the movement. So adding those two for 2 to 3 sets would be a great idea. Reps, figure it out, 8 to 15, just kind of keep it moving and think about progressively overloading that. Eventually, you could even add a weight if it's feeling much better. Simple dumbbell, 5, 10, 15, even 45 pounds eventually would be great. And you can see how all these things are something we want to build on for a future program. All right, let's do a quick review. So first and foremost, you want to keep moving and not panic, okay? We got to progressively overload. You got to be putting yourself into those positions that were vulnerable, but trying to stay in that 0 to 3 pain threshold. So not taking a step back by overdoing it, but also not being completely sedentary. These exercises should really help you systematically start to move your spine, whether it's your neck, your rib cage, your thoracic spine, your lower back, or even your pelvis. Try to control the motions, try to get nice and smooth, and eventually try to do all these things with little effort. Remember, there's a lot of guarding that goes on with back pain. We talked about the ability to regain pushing through the floor. We talked about the ability of not clenching your abs when you have to use your hamstrings. So just be aware of the overall tension you're holding and guarding in your body and begin to let go of that and do a little handoff to those muscles, your hamstrings, pushing through your feet, feeling your calves. All those things will help so much. If you want to train with us, check the links below. And if you're a personal trainer or a therapist and want to learn more about how we approach training, you can go ahead and check out the Personal Trainer Academy. We got the spine section, the rib cage, the hip mobility. It's all there waiting for you. Free trial is linked below. Cheers.